Hello, this is Myriam with the Healthy Living Resources telecast, where we are discussing what we know about COVID-19 treatments. We are here today with Jen Sabatino, who's a pharmacist, and she's answering a few questions for us. Jen, what are injectable treatments available for COVID-19?
In the outpatient setting, we have a preventative therapy called Evusheld for people who have not yet been exposed to COVID, but have a weakened immune system and may not have developed an immune response to the COVID vaccine or can't receive the COVID vaccine. Then we have a treatment called bebtelovimab for people who have mild to moderate symptoms of COVID infection to reduce their progression to severe COVID infection requiring hospitalization. Both of these treatments are monoclonal antibodies being used under emergency use authorization by the FDA. Monoclonal antibodies help your immune system recognize and respond more effectively to the virus. The FDA determines which monoclonal antibodies are authorized for use according to changes in the COVID variant that is prominent in the area, and the Ohio Department of Health allocates doses of these medicines based on supply and demand to the different facilities. Because the government purchases a supply of these monoclonal antibodies, they're often offered without cost for the medicine. The National Institute for Health's COVID treatment panel recommends the use of the antiviral medicines that you take by mouth over the use of the injectable monoclonal antibodies for treatment when they're available, because there's more evidence available for their effectiveness and they tend to be easier to administer. There's also an antiviral injection medicine called remdesivir that is FDA approved under the brand name Veklury. Previously, it was only used for hospitalized patients, but more recently it's been approved for use in non-hospitalized patients. It works by interfering with the ability of the virus to make copies of itself, similar to those medicines that you can take by mouth for treatment of COVID. It has a strong level of evidence for effectiveness, similar to those antivirals taken by mouth, but it can be more cumbersome to administer because it requires 3 days of infusion treatment. Additionally, because it's FDA-approved medication available commercially, use of this medicine would likely have a cost associated like other commercially available medications.